everyone. My name is Emily and I'll be hosting today's webinar. Thank you all so much for joining as we explore key topics in paediatrics. I'm delighted to be joined by an expert panel who will be sharing their insights into the challenges and advancements shaping paediatric care today. Throughout the session, we'll be covering a range of important topics from early diagnosis and intervention to the latest innovations improving outcomes for children. We have a fantastic discussion ahead. So to start, let's talk about how we can empower radiologists to provide safer imaging for paediatrics with reduced radiation risk. So I will go to David Lai from ClariPi.
Yes, yeah. Hi, my name is David Lai, and I'm the Technical Sales Director at ClariPi. And we specialize in CT image enhancement, dose reduction, and reporting solutions by leveraging the power of AI in radiology. To answer that questions, I can go into some research. The children are more vulnerable than adults to developing cancer after exposure to ionizing radiation. And so it's largely due to their developing tissues and longer post-exposure life expectancy. And so a 2019 study titled New Study Links Medical Imaging Radiation to Cancer Risk examined the association between the medical imaging radiation exposure and cancer risk among South Korean youth aged 19 and younger. And that study examined over 12 million young people and found that approximately 1.3 million of them had undergone diagnostic imaging procedure involving ionizing radiation, such as CT scans, PET scan, and angiography at least 2 years before they were diagnosed with cancer. The findings revealed that among these exposed individuals, there is significant higher cancer incidence compared to those who were not exposed. So with children being 2.3 times more likely to develop breast cancer, 2.2 times more likely to develop thyroid cancer, etc. So the authors emphasize the importance of limiting radiation doses to as low as reasonably achievable, also known as the Alara principle. They highlighted that every imaging decision should be justified by carefully balancing the benefits against the associated risk. So the Aurora principle is routinely applied in diagnostic imaging departments to safeguard both patients and healthcare workers. So, however, the Aurora principle does not define a specific safe radiation level. So therefore, there's no uniform implementation across different healthcare facilities. So each facility may have its own interpretation and operational threshold as to what constitutes a safe protocol. So this is largely because there's always a trade-off between radiation exposure and image quality. So some may choose slightly higher dose to avoid patient callback or repeated scans, favoring clear images over the risk of rescanning. So as a result, routine scans are not always performed at the lowest possible dose. So with all the advancement in CT technology and algorithms, ionizing radiation remains a significant concern. So at ClariPi, we recognize the urgent need to prioritize patient safety. To address this challenge, we developed Clarity AI, which is an advanced solution that powered by deep learning AI. It enhances the CT images while requiring less radiation doses compared to traditional methods. So with Clarity AI, it enables the healthcare facilities to reduce radiation doses by 40%, 60%, or even 80%, all while still delivering diagnosed quality CT images. So essentially, it enables the acquisition of high-dose CT images with low-dose CT scans. So the noisy components of the CT images are intelligently extracted and removed, resulting in clean, high-quality images optimized for radiologists' interpretation. And this gives radiologists the tool they need to maintain diagnostic accuracy without compromising patient safety. So patients who are especially susceptible to radiation, such as children, pregnant women, and oncology patients, can now receive worry-free diagnosis, ensuring the safest and most effective care possible. So our AI solutions is versatile, capable of enhancing images across the entire body, from brain, chest, heart, abdomen, and bone to bones, providing effective denoising for all areas. Claricitia was trained on over 1 million images to deliver superior image quality, making it an invaluable tool for radiation-sensitive patients. So this breakthrough not only elevates the safety of CT imaging, but also transform how clinicians approach patient care, providing better outcome with far less radiation exposure. Thank you very much.
Thank you. That was great and very valuable insight. This leads us nicely into our next discussion point. I'm going to go to Axial 3D, Daniel Crawford. I was reading about some research that was done at Southampton Hospital in the UK, where clinicians have been using 3D printed heart models to improve surgical planning and communication in paediatric cardiac care. They found the models to help surgeons prepare for complex procedures, enhance interdisciplinary discussions, and can also assist cardiologists in explaining conditions to parents. Given this, how do you see 3D modelling evolving in paediatric care, and what challenges might come with the wider adoption?
Yeah, I'll take that. That answers the question. So my name is Dan Crawford, and I'm the founder and the chief strategy officer here at Axial 3D. So a little bit about what we do, Emily alluded to. So we have a suite of machine learning algorithms which perform automated segmentation on not only CT, but also MRI and different DICOM stacks that will come from a pediatric cardiology center. So what algorithms will do is basically take that complex two-dimensional imaging stack of, say, a patient with a very, very complex pediatric congenital deformity, like an atrial septal defect, ventricular defect, or something very complex like a hypoplastic heart, and reconstruct that amorphous three-dimensional structure out of the two-dimensional imaging that the radiologists and cardiologists are very used to. And I think you'd already alluded to one of the studies that we've done with Southampton University Hospital to show the real enhancements that can make to the actual diagnostic and planning procedure for these very, very complex and ultimately one-off cases. Every pediatric congenital deformity is a little bit like a fingerprint. They are very different for every individual patient. So the cardiologists and the surgical teams have to really build a picture of that patient's complex deformity from two-dimensional imaging and really being able to leverage a custom-built 3D file, both digital and physical, allows the whole surgical team to get a much better understanding of actually what's going on inside that patient's heart. So from the cardiac surgeon, they know where to make incisions, they know where the patches are going to be required to actually fix that patient's deformity. And then for the cardiologist, it also guides them in getting a good understanding of where they need to do ultrasounds of the heart to really get an understanding of where the blood is flowing. And you've already mentioned it, the interdisciplinary communication within the surgical team is one thing, but given that these are all pediatric cases, a lot of the benefit that we are seeing from these physical and digital 3D files that we're producing using our machine learning algorithms from the 2D image stacks really enables or empowers the parents of these patients to really understand actually what's going on with their kids. And that really helps to kind of guide and really understand what is going to happen in the operating theatre. Because obviously, if your child is going in for a complex congenital deformity, heart surgery, it can be a pretty worrying time. And having anything that can help reduce anxiety around going into a procedure like that is hugely valuable.
That's great. Thank you so much. Just finally then for imaging biometrics, we have Mike Schminder. How do you envision the application of the imaging biometrics suite in pediatric imaging, particularly for conditions such as brain tumors or inflammation?
Yeah, well, thank you, Emily, for having me, and it's great to be with you all and learn about some awesome applications that you guys are all developing and have available. I'm Mike Schmein. I'm the co-founder of Imaging Biometrics and the CEO. And for all intents and purposes, our quantitative imaging platforms that we have available, which is IB Neuro, a perfusion MR approach, Delta T1 maps, a DCE module, and a diffusion module, they apply to the pediatric population in exactly the same way as they apply to our adult population. In fact, we believe that there is a large gap in what's being done in terms of advanced imaging in pediatric imaging as compared to adults. So what's being done in pediatric for imaging is somewhat primitive, and we hope to hopefully bridge that gap and help clinicians and patients out. So when it comes to our applications and how they're being used in pediatric imaging, it's like I said, it's the exact same way as they are used for adults. We can use our applications to identify the true extent of the tumor and where it is and where it resides. And then within the enhancing region, we can identify where the most aggressive parts of the tumor are. So if you're doing radiation planning or a biopsy targeting, you can make sure you're getting the most aggressive part of the tumor because you don't want to undersample. That would lead to a suboptimal treatment plan, of course, for the patients. Our software is used to identify whether a patient is responding to treatment sooner or for other methods, which is really important because if they're a brain tumor patient, they may not have a lot of time to be on the suboptimal treatment plan. They want to be on the most aggressive and appropriate plan. And of course, our software has been used reliably to distinguish progression from pseudoprogression, which is one of the many things that plague adult imaging as well. But there are nuances, of course, with developing brains and in children and the tumor types in general. But our software is, for the most part, very flexible to accommodate that. In fact, our software is being used at several large children's hospitals in the US here. And we were shared recently with a use case where our Delta T1 maps picked up some subtle regions of enhancement on the post-contrast T1 weighted image that cannot be seen by the visible naked eye. And when it did that, we used IB Neuro then to identify within that region where the aggressive parts of the tumor were and created a fractional tumor burden map, which again, our software is quantitative, so we can track over time how the tumor is responding to treatment or not. So it's essentially the same as adults it is for pediatrics for our software. And it's being used at some really prestigious hospitals and hopefully more in the future.
Just a follow-up from this. Could you tell me a little bit about the steps that are being taken to ensure the safety and efficacy for younger patients?
Yeah, so obviously there's concern with developing brains, right? You have the exposure to radiation, which was talked about previously, and contrast agents. Our applications are MR-based, so there's no radiation. But when it does come to brain tumors, of course, perfusion DSC imaging does require a contrast agent. So if you're a brain tumor patient and have to have follow-up scans, you may be concerned about the repeated dosing of gadolinium contrast agents. So what we've done for that is we have an option called a low flip angle approach, which has been shown to reliably produce similar results using 50% less gadolinium contrast agent. So that's a way to alleviate any concerns with the repeated dosing of gadolinium contrast agent. And then we also have a new product called IB-ASL, which uses no contrast agent and uses the body's own blood basically as the contrast medium and can generate some blood flow maps, which are very informative for neuroanalysis.
That's perfect, thank you. Finally, from AIRSMed, we have Ye-Sung Lee. How can we support radiologists to achieve fewer repeat scans and reduce sedation rates during image acquisitions of a pediatric patient?
Oh, that's a great question. This is an area where small improvements can have a big impact on patient care. As many of you know, getting high quality images in children can be challenging. Pediatric patients often struggle to stay still during a scan, which leads to motion artifacts, more frequent lipid scans, and in many cases, higher sedation doses. All of that adds clinical risk, operational complexity, and additional cost. From a hospital operations perspective, reducing scan time is one of the most effective ways to minimize motion exposure and lower the need for sedation. And that's where a solution like Swiftimer can help. Just to give a context, SwiftMR is an AI-powered software that enhanced MR images by reducing noise and improving resolution, particularly in cases where scan time is shortened. SwiftMR is a vendor-neutral solution that works across all body parts, sequences, and field strengths, and is already being used by over 200 institutions across the US. So, what this means for pediatric is that radiology teams can confidently learn faster protocols, plus, they can utilize quiet sequences and motion-robust trajectories like radial blade even more effectively. These kinds of sequences are often more tolerable for kids because they reduce motion artifact and acoustic noise, but they typically come with trade-offs like longer acquisition times, which SwiftMR helps to overcome. We've also collaborated with leading pediatric hospitals to validate this in brain and whole body MR exams, showing promising results not only in image quality, but also in reducing the need for sedation and rescheduling due to motion artifacts. In summary, by enabling faster, quieter scans with diagnostic quality images, we are supporting radiologists to make pediatric MRI safer and more efficient for both the patients and the care team.
Thank you so much, everyone, for such an interesting discussion today. It's exciting to see all the progress that's being made, and I'm really looking forward to seeing how these innovations will continue to improve the care for pediatric patients.